Hi, everyone. My name is Faith Day. I am an undergraduate student researcher at Libin Cardiovascular, and I am currently finishing up my degree in biological sciences at U of C. If you're watching this, you're most likely watching the live stream for the Info for Butterflies 2024 conference. To all those that attended, thank you so much for attending. We really appreciate it, and we loved meeting you all. I would like to apologize again for having to switch the live stream over to Zoom. I know that made it a little bit difficult and delayed the conference for a few minutes, and so I do apologize. I know that because of that, I also wanted to ensure that we had time throughout the day to let you all receive the amazing information that the presenters had to offer. And so I decided I thought it would be best to record this for you all and put the rest of my presentation prior to the conference live stream starting. And so I would love to record that for you for anyone who's interested. First, I would like to start with a resource that was provided to me by my healthcare team upon being diagnosed, and that I've continued to carry through with me while I go through my journey with TS. And so that resource is going to be called Turner Syndrome Across the Lifespan, and it is a book that essentially goes through each aspect of Turner's and explains what might be important to expect. What was explained to me also by my healthcare team is that given that each individual with TS may have a completely different experience, that it's important to use the book in order to fill in the gaps as questions arise and follow up with your healthcare team rather than using it as a general resource just to read through. I have provided the links for you on this slide. And so the first link will be the online PDF version of the book, which is free, of course. And then the second link will also be the full link to that. The third link will be a link if you would like to purchase a hard copy from the Turner Syndrome Society. Secondly, I would like to start off by essentially talking a little bit about my experience with being diagnosed and what that looked like. So essentially, what did my diagnosis look like, and what can a Turner syndrome diagnosis look like? So particularly for me in my situation, I was diagnosed at 15, which you might hear me mention throughout the live stream on the day of the conference. So for my specific situation, I had always felt growing up that there was a missing piece of me or a missing component of my life, and I didn't necessarily understand what that was yet. And I was always behind in terms of growth and development. I was healthy otherwise. In kindergarten, we did start noticing difficulties when it came to math or topics that related to math. And so I did receive a psychoeducational assessment in grade 3. Other than that, I was extremely healthy, and every time we had gone to a doctor's appointment, each physician had related my situation to the fact that I exercised quite consistently. I was a horseback rider, and I horseback rode competitively 6 to 7 days a week. And so that is what we thought may have related to what I was experiencing. At 15, there had still been no change in my growth and development, and my mom therefore decided to take me to our family physician, who we had just transferred to, and ask if we could move forward with some blood work in order to make sure everything was okay. And we did decide to move forward with that. And when the blood work came back, it did show that my growth hormone and my estrogen levels were not what you would expect for a 15-year-old girl. We therefore, at first, given the fact that I had been overall fairly healthy my entire life, that the most probable cause would be a pituitary adenoma, so a small benign tumor on your pituitary gland. And we therefore did move forward with an MRI to see whether or not that was the case. And we went forward with that MRI. When we received the results from that MRI, we were very surprised to see that the results were completely normal. And so my family physician had referred me to an endocrinologist regardless, as we did know I would need an endocrinologist no matter what the situation turned out to be. And so it was about 3 months between then and when I met my endocrinologist for the first time. And I remember walking into that endocrinology appointment. I wasn't necessarily too sure what to expect. I was wondering what possible scenarios there could be if it wasn't the most probable scenario, which was, as I mentioned, the pituitary adenoma. So essentially, I was therefore wondering what the scenario would turn out to be, and if there would possibly even be an answer to what I was experiencing. And if there was an answer, I was expecting it to be a fair amount of time before we found out what it was. And I remember that day, my endocrinologist walking into my appointment, and the first thing that they said was, "I think I know what's going on." And I was very surprised by by that reaction. As I mentioned, I was expecting it to be a good amount of time before we had any answers. And so that was a in the moment a relief for me. And as she went on to explain what TS was, I remember feeling a sense of clarity and hope that I was in the right place, and that moving forward, we had the resources to help move forward or move in a direction which would be positive. And essentially, I guess overall, I knew I was in a place where I could receive the help and support that I needed. And also in that moment, I felt a sense of clarity and hope that I hadn't felt my entire life, and that I had found the missing piece that I had been looking for. And again, in that moment, I knew that I wanted to do that for others one day. And so that's how I decided that I wanted to hopefully one day pursue medicine. Coming up, you'll hear Wendy as well as Dr. Sandra Koch chat to you about what to expect in regard to hormonal replacement therapy and growth hormone therapy, depending on different scenarios when it comes to diagnosis. And you will therefore hear what they have to say coming up in their presentations shortly. For me, given that I was diagnosed a little bit later at 15, we started growth hormone right away. First, we had done an X-ray of my left hand in order to see if my growth plates were open and if we had the possibility of starting growth hormone. And to my surprise, given that I was initially supposed to be quite tall, my growth plates were still open. And so we moved forward with growth hormone for about 3 years, from 15 to 18. And at that time, given I was a little bit older, we also started with very, very small doses of lupin estradiol tablets at the same time without progesterone, just to help a tiny little bit with that development aspect. Again, you'll hear a little bit more from Dr. Sandercock and Wendy coming up in regard to how hormonal replacement therapy and growth hormone therapy can play a role or possibly change depending on the age of diagnosis. And I guess adding on to that, that is a large portion of why I wanted to move forward with this conference, is I think that spreading awareness regarding signs, symptoms, and what girls and individuals with TS may be experiencing is so important in order to hopefully reduce the age of diagnosis. As you'll hear Wendy and um, Dr. Sandercock chat about coming up, is I know that the ideal scenario is hopefully being able to be diagnosed at hopefully a young age, and that way there's a possibility of moving forward with simulating growth and puberty as naturally as possible. What I would like to talk about next is how to cope while feeling overwhelmed, whether that's at the time of diagnosis, whether that's in the future after diagnosis, and what that looks like. You may be overwhelmed with the amount of appointments you're experiencing at a given time, or a specific situation you're experiencing at a given time. What I like to remember when I'm overwhelmed is that even though you may be in a group or a population that might be underrepresented, you aren't alone. There are other individuals who are experiencing a similar situation and are going through the same things and feel the same way. And that will be something that you'll hear us talk a little bit more about coming up in the live stream, and specifically with Dr. Heemstra's speech. And so I'm extremely excited for you all to meet her and hear her speech that she has for you. So as I was mentioning, for me, when I get overwhelmed, that's one thing I like to remember. And this is where I also like to stress the importance of formulating and surrounding yourself with a healthcare team that you feel comfortable with and can trust. And that way, when you do feel overwhelmed, you're able to kind of go to them and express that, and they will be able to hopefully adapt to how you're feeling and help you, give you some tools and some guidance and in order to move forward. Another thing I do like to always keep in the back of my mind also is that even though individuals with TS may face a lot at once, the one benefit is that we are screened on a constant basis, and that can, of course, lead to our healthcare teams coming to the realization that we may need help with something sooner. And that, of course, leads to earlier diagnosis and being able to prevent situations before they would typically be caught. And so I think that is also something that's definitely beneficial, that I like to keep in the back of my mind. Lastly, another tip that I like to remember or carry out when I'm feeling overwhelmed is that I like to, of course, stress the importance of finding mentors and placing individuals in your life who you have the ability to um, ask if you can place a little bit of the responsibility on when you are feeling overwhelmed, whether that may be bringing someone to your appointments to help write down and process the information so that you don't feel you're the only one to capture everything at one time, while also trying to make the best decision that's best for you. And that way you'll also have the ability to sit and talk through the different options with somebody who knows you well and can help you lean towards and determine the option that might work best for you. Furthermore, I think another thing to remember is that it's okay to experience emotion and go through the emotions that you're experiencing. And I also think it's important to when you're feeling overwhelmed, give yourself time, whether that be a day or two or however long you may need in order to go back and process the information that you need to process when you're in a good state of mind in order to make the best decision for yourself. Last point I would like to touch on, particularly with this slide, is I think it's important to remember especially during diagnosis, that your story is your story, and you shouldn't have to feel necessarily, I guess the best word would be pressured to um, express your story or tell anybody any aspect of your story that you don't necessarily feel comfortable involving. And again, I think that goes back to stressing the importance of having individuals in your life that you do feel comfortable going to, and you do feel comfortable talking through the things that you're experiencing with. And you'll hear Dr. Raj's speech on mentorship and involving those important individuals a little bit later in the live stream of the conference. And so I hope that that helps a little bit with that aspect for sure. I know that that was definitely something I struggled with when I was younger as well. So next, I would like to talk a little bit more about my experience going through school with a learning disability in math, and what psychoeducational assessments looked like, especially when it came to heading into university. So as I mentioned, I had my first psychoeducational assessment in grade 3. We weren't aware that I had TS at that point, and so I did have a couple of assessments with with us being unaware of that scenario. So we did know that I struggled with math and that I did have a learning disability in math. We just weren't aware of where that came from. And I remember with my first psychoeducational assessment, it was about a 3-day process. The first day or two consisted of my parents and I going in and essentially just talking with the psychologist and receiving a background, um, and going through the information that was essentially important for them to be able to consider while going through the assessment. And so we spent about a day or two going through that. And so I know that some parents might, if you have younger kiddos, might like to incorporate your kiddos in that, and some may feel a little bit less comfortable incorporating their kiddos in that, and that's completely okay. I know my mom was always liked to involve me in as much as possible, and so I did go to those appointments. And if there was a point where I was feeling overwhelmed, I remember she would kind of give me an activity to concentrate on in the meantime while my parents went through that process. And so the next couple of days consisted of the assessment itself. And so that involves reading comprehension, going through some math questions, reading, writing, and lastly, the psychologist asking me some questions. And I think the main thing to consider with psychoeducational assessments, especially as kiddos are growing up and becoming older, is that I think it's important to remember that the assessment is specifically targeting what you might need help with. I remember at first, I always struggled with that. I always felt that maybe I was a little bit less intelligent than my peers, or maybe I wouldn't necessarily be able to accomplish these same things because I had certain struggles that my peers didn't. And I think that it's important to remember that the psychoeducational assessment is specifically targeting what you may struggle with in order to give you those tools to succeed. And so it's a good thing in the end. um, Going into high school, I think that that changed a little bit for me. Just, of course, as you become older, you start to understand those aspects a little bit more. And so I think that, of course, as parents, it's important to have those conversations as you wish with your kiddos. And I know for me, specifically with high school at 15, I did receive my diagnosis, and so that helped me have a better overall understanding of why I was experiencing what I was experiencing also, and that it's not that I was any less intelligent or couldn't accomplish the same things as my peers. It was essentially I just needed um, to approach things a little bit differently. Next, I would like to talk a little bit about what going into university looks like with an IPP. So for me, I went to the University of Calgary, and so I can speak to kind of what what that looks like, and how an IPP is incorporated at U of C. I'm sure that other schools also have a similar process. I'm not 100% certain, but I think that, of course, as you become older, it's also a great thing as you approach university to hopefully get to know people who are particularly in similar situations to you and might be experiencing the same things. And that way, you can kind of work together and collaborate on the experiences you're having and what that maybe looks like. So what the process looked like for me heading into school at U of C is I worked with it's called Student Accessibility Services in order to, of course, upon being registered, provide your IPP. After that, once you are registered, you'll have access to all the accommodations that you need. Um, at U of C, we like to utilize the exam center. So if you have extra time needed, or you you tend to be able to concentrate better in an enclosed space without um, being in a lecture theater with a bunch of people around. That's all through the exam center, and so you will book your exams at least a week in advance for final exams. That will be the date and time will be given to you, and essentially you will write your exams at the exam center in order to be provided those necessary tools that you need. For me, I know that what those tools can look like can also be using a computer instead of handwriting an essay, or it might be because personally I struggle with math. It could be having access to a calculator. So as you go through those psychoeducational assessments growing up, you'll learn what tools work for you, and your psychologist, of course, will help you incorporate those tools so that when you head into university, you're well prepared. The last thing I would like to mention when it comes to this topic is that I know it can be specifically hard when you're trying. I know for me growing up, despite the fact that I was trying my best, sometimes from a teacher's point of view, it can seem as though you might not necessarily be putting as much effort in as you should, because at least for me, when I looked at a question related to math, it was essentially looking at a blank page. I didn't even know where to start. And so sometimes teachers had a little bit of a hard time until I was older, and I moved schools from between grade 8 and 9. And so up until I was a little bit older, I think teachers at certain points did struggle to realize that, and that I really was trying and putting the effort in to understand what I was learning. It was just I was having a bit more of a difficult time, and my thought process was different than everybody else, and that is completely okay. And I think that, again, when with parents, I think what really helped me is my mom always understood that aspect of how I functioned, and had those conversations ahead of time with my teachers, whenever we knew that there was something, whether it was an assignment, an assessment, anything that was coming up that I might struggle with. My mom always tended to have those conversations with my teachers ahead of time, and also at the start of the year, in order to explain the situation and why I might be why I might experience things a little bit different than everybody else. Of course, I also think that it's important to, which my mom did with me as well, to have those conversations with your with your kiddos, in regard to, especially, of course, more along the lines of when they get a little bit older. But I think it's important to have those conversations regarding whether or not they're comfortable with their story being shared. And you can kind of, I guess, gauge the way of the way that you approach and explain the situation to your child's teachers based on that aspect. All right. So next, I would like to move into some tips and tricks for a couple of different aspects of TS. So the first being growth hormone. So for me, I know in Canada, and I believe in the States also, we have the ability to use the Easy Pods, which is what I used. And so the your nurses, of course, will and healthcare team will, of course, go through the different options in terms of growth hormone injections with you and your family. For me, we did decide that the Easy Pod was the best route, I guess, so to speak, for me. So I remember once we officially had my diagnosis, we diagnosed me through a karyotype test through blood work. Once we did have that diagnosis, we moved forward with scheduling a date for one of the nurses to come, and we got started on the whole process of starting growth hormone. And so I remember at first I was quite nervous to start growth hormone. I hadn't, as I mentioned, I was fairly healthy in the past. It was actually when I got diagnosed with TS, with that, when I mentioned that blood work assessment, when my hormone levels came back abnormal for my age. That was actually the first blood test that I had had in 15 years. And so it was all new to me at the time. And so I remember, for me, then when my nurse came, she was so sweet, and I was so grateful that I had a positive experience while starting growth hormone. And I think, again, that kind of goes back to what I mentioned before, whether it's when your child is younger and you're making decisions for them, or maybe when you're older and you're making decisions for yourself. I think regardless, it's important to surround yourself with a healthcare team that you feel comfortable with. And so I was so grateful to have the healthcare team that I did. And when my nurse came, she was so sweet, and I did definitely have a positive experience. And she did give me some tips and tricks, of course, to help with having a completely new aspect introduced into my life. And so the needles. They're serifine needles, and so they're quite small. And so I remember they were they weren't painful. I didn't experience too much pain when it came to the injections, which is amazing. That was the main thing that I was nervous for upon starting growth hormone. And so that was that was an awesome realization that I came to. And in the beginning, we also did start with placing a towel and then an ice pack on top of my skin where we were going to do the injection. And that helps me with in terms of having a little bit more peace of mind when it came to the injections. And then as I became more and more comfortable, I slowly went to I should say I also had my mom help me at first. However, as I moved forward and I became a little bit more comfortable, I no longer needed that, and I no longer needed help. I moved forward with doing the injections completely on my own. I adjusted my dosing as I had been taught by um, my nurse when she let me know that it was time. And that I think is, of course, Wendy will talk a little bit more about all of this coming up and the different options when it comes to growth hormone and what that may look like. Um, However, that was my experience. I think that that's also where self-worth and advocacy are really important, is that it's important, especially as you become older, to have especially a healthcare team, but individuals in your life who you're comfortable expressing how you're feeling to and can help sit down with you and find the options and the tools for your specific situation to move forward in the best way possible. I think that a couple other things that are important to remember also are that when you have peers, friends, and individuals in your life are who are essentially contributing to a positive way in your life, one of the biggest components or signs of that is that they're supportive of who you are and kind of your goals. And I think that that's important to remember as well. And second, I think it's also important to remember that and this, I guess, is also going back to when you feel overwhelmed. But I think that it's also important to remember that things come in seasons, and sometimes life may feel more overwhelming than other times. And even though you might be feeling that in the moment, you'll also have times, I think it's important to remember that you'll also have times where you're focusing on the things that are important to you and that are positive in your life. And that goes to what I was going to talk about next, which is finding finding your path. And so you'll hear coming up, Dr. Heemstro's refers to kind of finding your why in life. And I think for me, that was receiving, upon being diagnosed, that sense of clarity and hope, and knowing that I wanted to do that for others one day. That led me to having something that I wanted to work towards and achieve, and that was important to me. And so that might, of course, that will be different for everyone, but I think when you feel that sense of clarity and hope of this is what I found, what makes me happy, I think that that is kind of um, what's important to focus on working towards. I wanted to talk a little bit more about my experience with apologies, hormone replacement therapy. So as I mentioned, when I first got diagnosed, I got diagnosed at a later age. And so we incorporated very, very small doses of estrogen along with growth hormone. And it wasn't until 18, so 3 years later, when we started to incorporate full hormone replacement therapy with progesterone. And so at first, when I was younger, the Marvilla or the Marvilla essentially combined birth control pill worked well for me. You will, of course, hear Wendy and Dr. Sandra Koch talk a little bit more about the different options when it comes to hormone replacement therapy coming up. Um, however, I just wanted to kind of mention what my experience was. And so, as I mentioned, the combined Marvilla birth control pill worked well for me when I was younger. And then when I started to approach university a couple of years after I had left team, my pediatric healthcare team, I started to notice a difference in my symptoms. And I think that that's really important to remember, is that you know your body best. And when you feel that there's something that isn't right, it's important to be able to, and of course, your pediatric team will help you find the best possible physicians in the adult world to refer you to before leaving the pediatric realm. However, I think it's also important to remember that that's okay to be able to go to your physician and explain that you feel that there's something different that you're experiencing, and um, you're hoping that they can help you move forward and figure out where that may be coming from. And so for me, at first, that wasn't necessarily the case, and so um, I did I did experience difficulty with hormonal replacement therapy for sure. Heading into university, I started to notice those menopausal symptoms. And again, you'll hear Wendy and Dr. Sandra Koch chat a little bit more about that coming up. But I definitely did start to notice those differences and changes in my body. And um, I knew that something may not necessarily um, be right. And around the same time, I started to experience severe anxiety, depression, OCD as well. And those were main symptoms for me in terms of my hormones being imbalanced. And so had to um, I had to reach out to multiple physicians. And I think that's okay to remember as well, that um, if you need to reach out to multiple resources until you find though that person that will sit down with you and help you really listen to how you're feeling and your goals. I think that it's important to find that person and be able to move forward in that way. And so other signs and symptoms I experienced were severe eczema. And I think at first that wasn't necessarily related by my healthcare team, but to being a sign um, of having those hormonal imbalances. However, looking back, I think it still definitely was. That's definitely to this day still um, a symptom for me that comes to comes to fruition when my hormones are imbalanced. And so I think it's important, as I mentioned, to remember you know your body best, and any changes that you're experiencing, definitely make sure to bring that forward because they are valid concerns for sure. And so essentially I did go, as I mentioned, I moved forward with contacting a few different physicians, and we did find out eventually that my hormones were completely, again, imbalanced, and that the hormonal replacement therapy, um, Marvilla, was no longer working for me. And we moved forward with trying different forms of hormonal replacement therapy. So at first, the first thing I tried was the Clamera patch. And the reason that my pediatric healthcare team had wanted me to initially stick to the combined birth control pill was, I know many could experience severe skin reactions when it comes to the patches, and I did experience that as well. And so I found that the patches didn't necessarily work the best for me from that aspect, although they did provide me um, they did provide proper proper hormone levels for sure. However, I was experiencing those skin reactions as I mentioned, and so it wasn't necessarily the best option. And so after that, we also moved forward with trying gels, and so on. And so what ended up working for me, which also had worked for me in the past, while on growth hormone, were small lupin estradiol tablets on their own, and then we also added in prometrium, so that progesterone aspect. And additionally, what we did for my particular case is we continued doing blood work, and this is where I think it's always, of course, important, at least for it has been for me in my case, to continue to receive continuous blood work tests to monitor those hormone levels. um, so essentially, as I mentioned, we went forward with doing multiple blood tests in order to find the dose of the lupin estradiol tablets that worked best for me, and kind of rose my estradiol levels to where we wanted them to be. And that ended up being what worked best for me. Of course, you'll hear Wendy and Dr. Sandercock chat a little bit more to you um, the different options for when it comes to that. I think the only thing that I would like to stress is, again, it's okay to come forward and have a healthcare team where you're able to express when something isn't necessarily working for you. I think, again, it's important, especially what I've learned kind of going through my diagnosis and experience with TS, is that it definitely is a spectrum, and what works for someone might not work for somebody else. And so I think, again, it's important to come forward and definitely express when you're seeing differences in how you normally feel, or also express when you don't feel something might necessarily be working the best for you. And essentially, when you do, for me, when you do experience those signs and symptoms with skin, so severe eczema or possible reactions to the patches, what I found worked the best for me were so I guess the Aquaphor petroleum gel, as well as the Nivea Restore and Repair cream and body wash. Those are kind of what I found worked best for me. I guess, again, finding a healthcare team that you do feel comfortable sitting down with, and letting them know how you feel so that they can help you find those best possible ways to move forward is so important. And again, I think I think that if that takes sitting down with multiple physicians in order to find what works best for you, and where you feel the most comfortable and who you feel the most comfortable with, that's important to remember that that's okay as well. So again, I know that TS is definitely a spectrum and everybody's situation can be different, but just to give you a brief idea of what my situation looked like before treatment with growth hormone, and estrogen replacement versus afterwards. I think that um, that can be that can definitely be shown in these photos. So the photo on the far left, I was actually um, believe it or not, that was a year after growth hormones. I was 16 at the time. Um, I definitely looked a lot younger. And then the photo on just to the right of that is when I was younger. I think I was about 8 in the in that photo. Um, and then the photo at the bottom there is actually my 16th birthday. So I think that was about a year into growth hormone, and I think definitely you can see for sure where I was experiencing those differences from my peers. And as time went on, I was so grateful to see those changes and receive the proper proper treatment to move forward and in a positive way. And so, just for a side by side comparison, you can see. So, the photo on the left again was when I was about, I would say 15, 16. And then after that, the photo to the right is into adulthood. So, that was after completing quite a bit of growth hormone and and then hormonal replacement therapy afterwards. And so, just to kind of give you a bit of a positive outlook, that you can definitely see those changes there. I think again, I had kind of touched on the last few points there in the previous slide, so I won't spend too much time on it. But I think in terms of knowing you have the right care team um, and preparing for that transition into the adult world, I think, as I just mentioned, starting kind of a little bit in advance and slowly introducing a little bit more responsibility as you move forward into kind of that last year, I think is important. And then also working with your pediatric team in order to find a group of individuals in terms of your healthcare team when you do move into that adult world that you do feel comfortable sitting down with and expressing that you feel um, you're feeling overwhelmed, or you're feeling you may be experiencing something that may not be typical for your specific situation is so important. And again, I think if you do have to sit down with a few different individuals in order to find those people, I think that's perfectly okay as well. All right. So lastly, are just some other topics I feel are important to mention are one, so definitely the fertility aspect. I know at 15 when I got diagnosed, that wasn't necessarily something I was thinking too much about at the time. However, when I got a little bit older, I think I did start to think about it a little bit more. And you'll, of course, hear Dr. Daniel talk more about this coming up a bit later. Um, However, again, I think that it's important to remember that we definitely are lucky to live in a world where modern medicine has definitely created so many amazing options. And I'm therefore definitely excited for you to hear Dr. Daniel's presentation. I think when I started learning more about the options that are there for girls who do struggle from a fertility point of view, specifically with TS, I think that definitely helped me cope and have a positive outlook for sure. And so, as I mentioned, I'm excited for you to hear Dr. Daniel's presentation. Um, and then again, I think when it comes to feeling overwhelmed with having a body that functions differently, I think that again, having a healthcare team that um, you can um, you can sit down with and express that to, and therefore move forward with finding a treatment where you do feel comfortable and you do feel that you are able to move forward in a way that feels that you feel the most comfortable with, again, I think is so important. Um, I think, again, when it comes to achieving your goals, when you feel discouraged, again, I think it's important to refer to kind of finding your why. And I think when you're passionate about something, I think that um, it keeps you going for sure. And I think if it takes some time to find what you're passionate about, I think that's completely okay also. And I think that's where kind of venturing out and trying new things, trying different things comes into play for sure. Um, for me, that's been working towards medical school after finding that sense of clarity and hope and wanting to do that for others. But I know for everyone else that may look different. And so I think finding that aspect of your life is extremely important also. And you'll hear Dr. Heemstra chat a little bit more about that. Um, and then in the sense of having an appointment when that you're nervous for and coping with that, I think again, incorporating those people to in your life, whether that might be a friend, a family member, or anyone that you feel comfortable to bring with you in order to be another um, source of interpreting that information, and so that you don't feel um, overwhelmed in the sense of having to take all that in at once while also making the decisions that are best for yourself, and also having a healthcare team that you feel comfortable with is so important. And I think that also helps with the next point in terms of feeling like those around you don't necessarily um, understand. And I think that um, when you do have healthy relationships around you, I know I struggled with this when I was younger. However, I think when you do finally find those individuals, whether that might be through finding what you're passionate about and therefore interacting with others that are passionate about similar things, or um, maybe you find kind of a friend group while attending a conference, hopefully such as this, or um, whatever it might be. I think that when you do have healthy relationships surrounding you, I think that you'll feel that those people support you for who you are, and that you don't necessarily um, feel that um, feel that they will I guess the best way to describe it is you won't necessarily feel uncomfortable by expressing how you're feeling. Hopefully that makes sense. Right. So thank you so much to everyone for being involved in the conference, and whether you attended in person or you're watching the live stream, or however that however you may have been involved, thank you so much. And I hope that this helps. Feel free to hopefully share to anyone you think that this could possibly have a positive impact on. I think that again, it's important that to interact with one another, and to hear from those around us. And that's why I'm so excited for you to hear from everyone who spoke at the conferences. I think they're all so amazing at what they do. And as I mentioned, I'm so excited for you to hear from them. And so um, without further ado, please enjoy the conference live stream. And um, I hope that again, I know that everyone's experience is a bit different, but hopefully kind of walking you through what I've experienced going through a diagnosis, um, and then some time afterwards with TS. I hope that it kind of helps give an idea of what maybe to possibly expect. And yeah, as I mentioned, without further ado, enjoy the live stream. And we'll also be I know on the day of that we didn't necessarily have time because we were running a little bit behind, unfortunately, due to the live stream in the morning. We didn't necessarily have time to incorporate my mom's speech either. So we will be incorporating that at the end of the live stream. So let's get started.